it's always wonderful to talk about where we are coming from and where are we now, because most of the time history teaches us where we are coming from and how to do things better in a time where we are in. I will talk to mostly access to medicine. I know most of the people, maybe they know the history of TAC and access to medicine. We all know that TAC was launched in 1998, but we had a long road in access to ARVs and other medicines that are very essential in the country and even nationwide. We know that people were dying of HIV, and we know that we needed an intervention, as now we need intervention since people are dying of COVID in our era. But not only COVID, we are now talking COVID, we are now talking cancer, we are now talking communicable diseases. From the history of TAC, from 1999, we started to work on access to treatment, of which one of our marches, which was the significant march in Parakwana, 1999 march, where we were calling for PMTCT program to be implemented in the country, which we were calling also for nevirapine to be given to pregnant mothers. And that a struggle, it was not an easy struggle, because it took us about 2 years for a court in South Africa, constitutional court, to force or force government, yes, to provide nevirapine to pregnant women. We also have another case, the fluconazole in defense of Pfizer patent. We know that patents always blocks access to treatment. As now we are talking of cancer treatment, we've been seeing TAC in the past few years marching to different pharmaceutical companies to say you cannot continue to charge high prices of cancer medicines like trastuzumab, which is a breast cancer medication, which is very expensive in South Africa. As much as now the government can be able to buy the drug from the pharmaceutical companies, but still it's still expensive, because government has to make submissions to make sure that they get that drug. And even if you are using a private sector, we are unable to access it. We started to see the rollout of ARVs in 2004, and it was very slow. And as much as today, we are talking about high number of people living with HIV being initiated on treatment or on ARVs. And as much as we are talking about that today, but we still have challenges when it comes to HIV people, HIV positive people accessing treatment. They asked me to talk about broken healthcare system. Now I will focus on that to say today, I think you have seen last month where TAC in Gauteng slept 2 days, spent 4 days and 2 nights outside the Premier's office, demanding answers and commitment from the Premier of Gauteng and the MEC of Health in Gauteng. It is so embarrassing and disappointing to say, even this time of the year or this time of age, we still have ignorant or leaders that do not have a political will in fixing the broken healthcare system. When we talk about the broken healthcare system, we know in Gauteng, we had a tragedy in April where one of the hospitals, and the largest hospital that services cancer patients in South Africa, it has been banned because of poor maintenance. And that hospital, it took months for them to renovate the hospital and open the hospital. But it was due to I'm sorry about that. There's something that is disturbing me. It's due to not having a political will from the leaders in the province. But then I'm also want to focus of why the broken healthcare system is broken like this. As much as we had challenges, and we know that there's been underutilized funding, and people, the Department of Health was not using the funding accordingly. And we know that other service providers were not paid in time because of the challenges that the Department of Health created because of corruption. As we are sitting with you today, we know that the former Minister of Health, Zweli Mkhize, has resigned as the minister because he's running away from what he has done. He has stole about 150 million with his family and friends. And that money was supposed to save these people on the ground. We are talking about shortage of human resource on the ground, which is still problematic, which makes more people not to be able to access services in facilities due to poor healthcare system. So as much as we are saying it's broken, actually the healthcare system in South Africa, it's not broken, it has collapsed. Because for a person to access services in the public sector, you have to spend the whole day in the facility. You have to wake up early in the morning around 4 o'clock and come back at home around 2:30, 3:30. What does that tell us? That our healthcare system has collapsed. I'm talking to you today. We know that we are always, and we just finished Women's Month in August. We are in Heritage Month, but we are celebrating all these months, calling them by names, while women are still struggling to have contraceptive. A mere contraceptive in South Africa, it's a problem. We've been facing the shortage of contraceptives since ever in South Africa. It's not only this year. This challenge, we've been having it before we had COVID. Even today, we still have that problem. We still have shortages of ARVs in the country. We still have challenges of vaccines, especially the COVID-19 vaccines in other provinces, like in Western Cape. The past few months, July, early August, there were no vaccines, and they had to run around borrowing vaccines from clinic to clinic in order to vaccinate people. And while we are still talking about vaccine, it will be wrong for me not to talk about TRIPS waiver, which it's problematic where the world now determines who's supposed to get the vaccine, and they want to put it under patent. 2 weeks back, we were working with Africa Alliance to push or put pressure on Germany embassy and to Germany to say they need to push for not to sign a TRIPS waiver so that other countries can be able to access COVID-19 vaccines. We have lost millions of people due to COVID, and we cannot now sitting here and pharmaceutical companies wants to make money or makes profit out of people's lives. We are saying no profit and in favor of people's lives. So not that we can talk about, but due to time, and we know that the discussion has to continue, I will stop there for now. But before I stop, Lauren, you will pardon me. You know what makes us to have the biggest program of ARVs today? It's because people were educated on the ground, and we continue to do that. And when we talk about COVID-19, we are not having much education that we are giving to people. So it's up to everyone who have information to give information to people on the ground. We are having people who are anti-vaccines because they are not informed. Only myths and fake news are distributed, but right information, it's not well distributed. And we need a simplified language like we did on ARVs. You can't expect people on the ground who have never went to university to understand SARS-CoV-2, what is that? And you saying you are giving people information. Yes, in South Africa, I have seen several times where Professor Slim, Professor Glenda Gray, they have been trying to explain these issues on national television, but that is not enough because the English is too deep. So we need to simplify it so that we can be able to share this information to the people on the ground.